we are looking at HSG, which is a radiological procedure. We use this procedure to view the uterus and the fallopian tubes. So this procedure involves use of or introduction of contrast media into the uterus through the cervical canal. And you're going to be taking spot films, and we are aiming at seeing if the fallopian tubes are patent. So the most important reason why we do HSG is to test the patency of the fallopian tubes. That is the most important reason. So if we go to the next slide, we're going to look at the indications. So in our indication, most of the patients that come for this HSG, they are because of the infertility. So infertility is the biggest reason why people come for HSG to the facilities. So I got from the percentages, they said 50 to 60% of patients that come for HSG, they are infertile, so they are looking for the reason why they can't get pregnant. Then we have a history of recent miscarriages. When someone is really getting a lot of miscarriages, they can find out why. Then we have history of a pelvic pain, congenital acquired uterine abnormalities. We are going to see some images down there which can show some congenital and acquired abnormalities, uterine abnormalities and fallopian tube abnormalities. Then it is a baseline for investigation before tubal or uterine corrective surgery. So we have some surgeries that are done, but maybe a patient they're going to do it like someone had tubal ligation, and all of a sudden they want to get pregnant again. So they're going to do the surgery. So they first do this to confirm if they can go ahead and do it. Then we have on rare cases, we use it to check on the integrity of the CS scar. This is cesarean section scar. So its integrity. Then also to assess the succession of tubal ligation. So some patients who have had tubal ligation, this is also rare, but they can do this to assess if the tubal ligation process was a success. Yeah. So those are the indications we're able to get. Then the contraindications.
To start with, primarily we have pregnancy. So if a patient or a person comes for such an exam and is pregnant, you are not recommended to do this. And for which reason, the woman will, or the patient is asked to report on the second or the third day after periods. That is to ensure that you are not doing an exam, or you will not end up killing the preborn baby. Then the other thing is the other contraindication is active pelvic infection, and in this case, we will not do this exam because we don't want the infection to spread, being that there is a high risk factor for the infection following this procedure, and therefore this becomes a contraindication. The other point is if a patient has recent surgery on the tubes or on the uterus, this is also a contraindication due to likelihood of the uterine perforation and tubal rupture, because remember this person is just healing. Then the other thing, it is also not advised to perform an HSG during menstrual period or immediately after it, due to increased risk of intravasations. Remember during menstrual periods that blood vessels open up, and and in this case we are starting, or we are introducing contrast into this patient's body, and therefore this contrast media might move, and we'll have challenges, or we'll end up having complications. Then the other thing is that we will have to ask the patient, or find out that if the patient has hypersensitive issues or to different contrast agents. And lastly, active bleeding from the vagina. If the patient has active bleeding or suspected malignancies, they are also not advised to do such a procedure. Thank you for now.
We will look at the 10-day rule and you understand why we don't do the immediately after what? After menstrual cycle, after menstruation, sorry. So we are going to look at patient preparation. Under patient